Bienvenidos! I am Nanette, and today I'm going to talk to you about connective tissue and your relationship to your connective tissue, what it is, and how it may be affecting you. If you haven't liked and subscribed to my channel yet, please do so. I would love to be here and continue to be here to support you and interact with you. Thank you so much for being a part of my community. So, what is connective tissue? Well, first of all, I'm in love with connective tissue. This is what I do in my work. This is how I educate my clients. And connective tissue is a binding substance. It's basically a grounding substance in your body that's connected to everything. All of your organs, all of your tissues. It binds to bone, it binds to cellulite, and it can actually affect your posture, your behaviors, your emotions, and your alignment. It can also be a huge contributor to scar tissue and how you hold scar tissue patterns in your body. Connective tissue binds, supports, and protects you. And it's really important to understand that it's not just against bone or along bone, but it is also, it's around your organs, it's around your muscles. It's basically the glue that holds you together. And one of the things that I really love about connective tissue is when I was in massage therapy school, we learned about connective tissue being the endless web. And one of the classes we learned about it the most was in cranial sacral, which is a huge passion of mine. It's the modality that I love the most, and the modality that I really love to work with people. So in this particular class back in school, a long time ago, we learned that this connective tissue binds to everything from top to bottom in our bodies, from inside, from diagonal, from this way, from that way, and according to our postures and our movements in our bodies and our hobbies, it can shape-shift us. And when we get injured and our connective tissue is trying to keep the balance in our body, it can actually affect our emotions. Injury can get really stuck in connective tissue, and emotion goes along with it because everything is recorded in your body. Your body is so brilliant that it's like a time capsule. And every single time something happens to your body, whether it's anxiety or trauma or posture or behaviorals, like if you're at your office and you're just sitting like this all the time on the computer, it's gonna hold you that way. We are on our phones a lot more often. We're on our computers a lot more often. We're slouching a lot more often. And these postures start to become behaviors, unconscious behaviors. And after a while, our bodies will hold us to it like super glue. So this slumping posture, especially in children, will affect the way that you're breathing. And because of the lack of oxygen, it will affect the way that you're thinking. It would affect the way that you're feeling. It affects your performance. If you're a golf player, you have some different patterns because you're twisting. If you're someone that travels often and you're always sitting, you're gonna have a lot of different kinds of patterns in your body because you're being held to it. Also, a big, huge problem that we're having in society is weight gain from stress and from inflammation. And the connective tissue will bind and hold onto cellulite. And that is why you get that lumpy cottage cheesy effect in your body, because the connective tissue becomes condensed. As the adipose tissue, which are your fat cells, they do expand, and it starts to get so tight because there's so much inflammation in your body that it starts to become very rigid. It's like if there was a lot of scar tissue in your body. So it holds us to these behaviors, it holds us to these patterns. And when we have long-term patterns in our body that have been with us for a really long time. Say you were injured as a child, you broke a bone, and there is a specific pattern that now is stuck in your body, and you go get a massage. It will wake up emotions of that trauma. It will start to affect the way that your body is held in alignment because of the shifting. You may have compensated on one side while you were trying to protect another side. So as you're protecting yourself and you're trying to also, because of the trauma, compensate so that you are not hindering yourself even more. It's something natural that we all do. You know, we start to lean to one side. We start to use one foot more than the other if we've injured an ankle. If our hips hurt, we start to use the other side as we're sitting, and then we start to shift to the side like this. People, when they're driving, they kind of lean over to one more side. Even just having one foot on the gas and one foot down can affect your shifting in your body. So lots of different things, sleeping patterns, sports, if you're into different hobbies, if your neck is down a lot. You know, as massage therapists, we're arms forward, neck down, we're on our feet all day long. We're sometimes leaning over people's bodies to get to the other side as we're doing some pulling across the abdomen or the ribs. So these behavioral patterns also do come with emotions. And as we're doing those things, we're thinking, feeling, thriving, surviving. The stress sets in. If you've had an injury, then so as trauma sets in, trauma starts stacking on top of each other. And these patterns start to set in of compensation and overworking and stress to the body, because it can create anchors, not only as far as your anatomy in your connective tissue and holding on to keep your body balanced, but it can also keep those emotions of the stress and the trauma in the tissues. And it becomes less efficient for your body to have these anchors and these patterns. It makes it a lot harder for the body to be productive when it has to be compensating and it's not in alignment. And as time goes on, say you hurt your ankle, and through time it's going to start traveling up because it's going to create a problem going up to your knees, going up to your hips, going into your pelvic floor, going into your diaphragm, going up into the chest, in the shoulders, and eventually, oftentimes years and years later, it becomes neck pain. This is something that can happen also if you've been in a collision and you get whiplash. And people are like, oh, I'm okay, I'm not really that hurt. And then years later, all of a sudden something happens where their necks and backs are hurting, and it's been sitting there festering for a really long time. That's why it's really important that when you get hurt, when there's trauma, when there's collision, it's important that you get consistent care so that you don't get stuck in that pattern. So what can you do about these things? Well, you can go get body work. It's really also important to understand that not every massage therapist works with connective tissue. Not every person does medical massage or structural work. And so if you've had trauma and injury, look for a specialist. It's really, really important. This is something I always tell my clients. I'm like, well, I've been going to this place, but they haven't done any of this work. You have to have a specialist who is actually familiar with this kind of work so that you can get the best care that you can get. Because there are so many different types of therapists and so many different types of massage. Physical therapists oftentimes really specialize in trauma and healing and being able to get your body back after injury. A massage therapist can also do that for you. You just have to remember that you have to be very specific, because not everybody has the same education and not everybody works the same way. So it's not just about getting any massage just because you're getting circulation work or just because you're getting a massage does not mean that you're going to be getting the work to help you get back into alignment. This is very, very important. So when the anchors and the trauma sets in, it can affect you emotionally because your body is no longer working at optimum. It's now been interrupted. You have these cellular matrices, these fibers and the collagen and all these other things that it connects to, they're now changing. They've changed. They're different because now it's set in as far as patterns and behavior and emotions and all these other things. And your body is trying to find balance. It's compensating at this point. And it can also affect the way that your alignment is from anterior, posterior, above and below, and across from your body, from one side to the other. It can cross over diagonally. It can cross over from the back to the front. There's so many different ways that your body, its genius mechanisms, will try to keep you standing up straight. And it's not always fun for the body. It can consume a lot of energy trying to keep you straight, on top of the stress and on top of all the other things, including sleeping patterns. If you're not getting really good sleep and you're not getting comfortable sleep, we do some really funky things while we're asleep that we don't even know, that we're completely unconscious of. And so while we may not always understand, the body understands it. The body is genius this way. And the body knows where alignment should be. The body knows the way we should be held up. It knows that if we're compensating, it's going to take a lot more energy. And it's important that you understand how connective tissue can affect you. Because if you're feeling a certain way and you don't know what you did, start reflecting back on what's happened in your life and how you could possibly be compensating. It will really help you to get to know yourself a lot better, and it will really help if you speak of the history to whoever's taking care of you, as far as a physical therapist or a massage therapist or even a chiropractor. Anyone holistic usually tends to understand this stuff. So, and if you are doing foam rolling or tennis balls or stretching and it's hard to get that stretch and you feel stuck in certain places, you're dealing with connective tissue. You're dealing with possible scar tissue. You're dealing with old trauma that has now surfaced in other places as your body is anchoring and compensating. So these are good things to know, to pay attention and to tune in, so that you can understand what can you do better and how can you perform better. And if you're just feeling really, really off, just check in and see what it is that your body is doing. Like, just postural wise, like what kinds of habits do I have? You know, how I've been sleeping. A lot of people sleep on their side with their arm over their head. After a while, your body's gonna get mad at you. And so become friends with your body and get to know yourself better. There's so many answers in the way that you hold yourself. We all want our body to perform better, because when we perform better, we thrive. And that is what helps you become successful. Thanks for joining me, and remember to like and subscribe. Comment if you want to know something. I'd love to stay in touch with you. It's so wonderful to have you join me in community. I believe that it is really important to communicate, collaborate in community, and we're all sharing and helping each other be our very, very best. Gracias.